Hello and welcome to episode 84 of Tom's Hirschsprung's podcast. Hello and welcome to episode 84 of Tom's Hirschsprung's podcast. I am delighted to be joined by two people with Hirschsprungs this morning, Gemma and Carl. Gemma and Carl, welcome to the podcast.
Thank
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 you.
you.
Now you are father-daughter, so obviously
Mhm.
Hirschsprungs has been passed as well, and Gemma, your daughter, and Carl, your granddaughter, has Hirschsprungs as
Yes.
well. And we're going to talk about, I mean, not just the fact that it has passed through, or Hirschsprungs has passed through three generations, but you've also got a very rare genetic form, I guess. I know we'll talk about it a little bit
Mhm.
later,
Yeah.
of Hirschsprungs that's been passed through, which I'm fascinated to find out with. So I guess we'll kind of start as we always do, and kind of start from the beginning, if you will.
Yeah.
Right.
On to you then.
Well, I'm Dad. I'm Carl. I was born 1960. Obviously, I had Hirschsprungs. I'm not 100% certain of all of these because my parents have passed away now. But I believe that was about 3.5 weeks I was diagnosed. I
It's
believe,
quite, I can remember
yeah,
saying
yeah,
it's a long time to diagnose.
yeah.
Obviously, back then, it wasn't heard of a lot,
No, it wasn't.
and
No.
they weren't
Well,
100% sure what it was,
I
weren't they?
was in hospital for nearly 3 years.
Three
But
years.
yeah, 3 years. Three
Mm.
in total. My last operation was 3.5 years. So them days we weren't allowed to laugh. They had to do things to distract me from laughing because and
Mm.
the operation I had is large. I've got all my stomach is completely full of scars, whereas my daughter's
Yeah, it's just
has
one big
one little
one.
tiny scar. So progression is amazing
Mm.
in the 64 years.
And Jessica's even small. I mean,
Uh,
mine goes right across my tummy, but Jessica's
yeah,
is
it's
about that
one
big.
can't see
Yeah,
it.
yeah,
Yeah.
it's brilliant. Well,
So
lots of little ones, but the biggest one is about that big, and
yeah.
that's where her stoma was.
Yeah. So, but
So
that
it's
was
a bit of
not very
progression.
well heard of them days, was it?
No, not in
In
your
the
days.
60s and that. So I eventually came out of hospital about 3.5 years old. Got photos
Yeah,
of being in
got lots of
hospital.
yeah, got the
Yeah.
cutest photo of him
So,
in the hospital.
yeah, and I said, I've suffered with it obviously for 64 years, but I think you learn to live with it.
Even allow Nan and Greta to come in and visit
Now, I had no visitors.
that whole
My mum
time.
and dad just had to look through the window because I used to cry when I saw them. And they didn't want me to cry, apparently.
But you
Yeah.
had a long segment,
I
didn't
had a
you?
long
Like
segment.
2/3 removed
Yeah.
of his large intestine.
Yeah, I've had a few problems over the years. I in 1966, and believe it or not, I can actually still remember it. I had a lot of cockles. Um, I had these cockles, and I put me in hospital for 6 days. Stomach pump, everything, and basically what it was, my stomach wouldn't allow the cockles to be eaten up. The acid wouldn't allow that, so they went bad inside me. So that's stomach pump and all sorts. Still remember that quite clearly, even though I was six. So there's no more cockles. They said no
No.
more cockles. So I haven't had none since. I maybe had one, maybe two,
That
and
push, yeah.
that push the trucks. I like them. It's a shame, isn't it?
Well, yeah, every so often.
Things that I love to eat, I can't eat
Okay.
because they upset my
Well,
stomach.
as I said,
So annoying.
as life goes on, you learn what you can get away with, what you
Mm.
can eat, what you can't eat. Um,
And then you think, oh, I will have that peanut
oh,
because
peanuts. Oh,
it's Christmas and I'll just deal with it later.
peanuts are an absolute no go for me at all
Me
now.
too.
I
Me
had an
too.
episode, how many years? 4 years ago?
Yeah.
About 4 years ago, where I thought I was going to be rushed to hospital.
Yeah.
I just that was it. That frightened me. It really frightened me bad. I was in so much pain, and ever since then, my wife constantly is having to go at me, say, "Chew 'em properly, chew 'em." But yeah, all my school life was hard. I had a hard school life because no one understood, and you get bad wind, and you get can't go to the
Mm.
toilet. Then you have to go to the toilet, and then you have to be close to the toilet, and oh, it's just nightmare. But living through it, looking back on it now,
Mm.
I think I cooked quite well.
Mm.
A lot of support of my family.
Mm.
I could then pass all that information on to Gemma, but she suffered different,
Yeah.
a lot different than I do.
You can tell in my earlier part of the story because I can't remember it,
No,
obviously.
well, and that's the sort of like I've dealt with it in my way. Like you have to lay on the floor on your stomach, and my wife rub them back now and again. Not very often these days. I seem to get better.
Mm.
The flatulence, the wind, oh, terrible. Quite good fun though. A lot of people have a lot of laugh with
Well, you can't help it, it's my Hirschsprungs.
it.
So,
Exactly. We have an excuse for life. It's great. Absolutely brilliant.
I use it. I use it. Believe, trust
Oh
me, I
yeah,
use it. But the thing
absolutely.
is, all my life, I worked in a factory most of my life, but I always wanted to be a lorry driver. When I was 55, and this is part of Hirschsprung's, I'd started to drive a lorry, took all my tests and that, and late developer. But I found I was not close enough to the toilet when I was driving lorries. Could not. So that didn't last very long.
no.
Then I started driving lorries locally, couldn't get to the toilet quick enough.
Mm.
So I had to give that up. So then I retired early.
Well, you became a binman, didn't you?
Became a bin,
A few times.
drive the bin lorries,
Yeah.
and the amount of times I got caught, oh, the pain. The problem with me, I'm talking in my case, is that if I don't go to the toilet when
Mm.
the urge is there, the longer it goes on, the worse the after effects are,
And the
and
longer
the longer it lasts. So
yeah.
I can have after effects 2 or 3 days. So if I go to the toilet, or if I can't go to the toilet immediately, them after effects are completely reduced. I can get over it in 2 or 3 hours. So that's how I do it.
Also, after my nanny died, which was nearly 17 years ago, my dad got through stress. We thought it was through
Oh
stress.
yes,
Really, really got chronic
hiccups.
hiccups.
24 hours a day.
Really, really bad.
Timmy.
Yeah, and it was 24 hours a day, and it was very dramatic
Oh,
hiccups, and would keep him up in the night,
couldn't
make
breathe.
him sick, stop him breathing because it was so dramatic,
Oh,
wasn't
in
it? He
hospital.
couldn't eat anything. As soon as he ate anything, it would come up again. Went to hospital, and
Yeah.
it was and you
And,
now still get it. It's not as bad
and
as
scoped twice now to check see if they thought some kind of cancer or something to do, didn't know what it was. Everything was clear.
yeah,
Then it'd go off, and then 3 or 4 weeks later, come back for 2 or 3 weeks. And when I say come back, I mean the hiccups were so violent
yeah.
that the chest I felt as though I
Sorry,
had a
that
heart
helps
attack.
out. Yeah.
Really, really bad.
However, we've now recently, because
Yeah.
we will go into this more later on when we're speaking a bit more about Jessica, but we had genetic testing done. And they're now thinking it could be due to Hirschsprung's,
Hirschsprungs,
linked to Hirschsprung's.
because it's all part of the nervous system. Because
Interesting. That's really
yeah,
interesting.
well,
Well,
Yeah.
Dad's gonna, because my daughter was genetically tested, but then they want Dad to have it done, which you're gonna do, aren't you?
they're all
And they're gonna see if it's linked.
the
I think
hospital
it
had to
could
jump
be.
through hoops at the moment. They're that excited about it, the geneticist, because of this rare we are. And he said, and I said about the hiccups, and Gemma said the issue she's have, and he went, oh right, and he wrote things down, and
Yeah,
he said, oh, would you mind a genetic, a test? I said, yeah, definitely. And we said, about the hiccups, yes, possible. And he's sort of like, oh,
yeah.
he said, I'll have to investigate that because the hiccups, he said, is part of
The gene that we've got.
the vagus nerve,
Yeah,
which is part of the gene.
Yeah.
that is defective
It's
enough.
defective, you see. And he said,
Yeah.
well, I could do it. So that means some of your listeners to think about if they get hiccups, that possibly could happen. But I never had it since my mum died. I just had got my last bout of hiccups
Yeah.
about 2 weeks ago.
Mm,
But that's not as severe now as it was.
no. We've
No,
made us think that it was stress related because
yeah,
it would always happen around the time when you were
yeah.
stressed
When I
out.
was stressed out, yeah,
So that's which is what made us and the doctors think that.
yeah.
But when we brought it up to the geneticist, he was like, no, it could be linked. That
So,
is a strong
so
possibility.
that's one to sort of keep hold of.
Mm.
But he
Yeah.
said, oh, he's got to investigate for
Yeah,
me.
it did. Yeah,
So
it's really
I mean,
interesting.
if I can get a diagnosis, if he can say me that's part of it, then I can live with it. That's half the cure. If
Yeah.
you know what that's about,
Absolutely.
because we just couldn't go. I just couldn't do anything, could it?
No.
In my life, couldn't
No.
work. Well, I worked through it, but you've been sick all the time. You had the hiccups, you keep your headaches, and all sorts. All
And
that
to
hiccup,
deal with Hirschsprung's as well.
and then the Hirschsprung as well. I was having problems with. So, but as I said, the problems with Hirschsprung really doesn't affect me.
No.
I'm used to it. I
Yeah.
very different.
So, you really do deal with it, don't you? And I'm like, yeah, but I don't know any different. So
Yeah.
to me, this is normality. I don't
Yeah.
know what it's like not to have
And
it.
we always have a chat about it.
Yeah, we talk about it
We're
a
in the
lot.
gang, you see. We're in
Yeah.
the Hirschsprung's gang. Me, my daughter, and my granddaughter.
Yeah.
So the rest of the family can go away. We're in our little group.
But you're
My
right
mum's
though.
like charm. My mum's sitting there. She's like charming. But I've been through it too.
Yeah.
She's like, I've been married to one, been a mother to one, and a grandmother to one.
Yeah. She
You're
knows all
right
about it
though.
as much as we do.
Sorry.
So,
You're right though. We do
Yeah.
just get on with it, don't we? We do
Yeah.
just kind of because I guess because what choice is there? You know, what else do you do? But
Exactly.
we do just kind of. But if we were to write down, you know, in a month or whatever or a year, what we what we deal with, you know, the pains or the stomach cramps or you know all of this, that, the other, to write them down and show to a doctor, they'd probably put you in hospital for a week because
No, they
they
would.
go, "What on
Yeah.
earth is this?" But it's like, well, we
Yeah.
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 just get on with it.
Yeah.
Yeah.
We're quite passionate about
Yeah.
we're quite passionate about helping people as well.
Yeah, we are. Yeah.
Me and Gemma, we're very passionate. The other Hirschsprung community
Yeah.
to understand what we go through as to help them with their
It's funny because once a year, my doctor's surgery, because I've had 3 cesareans with my girls, they know I've had Hirschsprung, so they don't bring that up, and they always ring me up and go, "Oh, you've had three cesareans. Is there any chance that you could come in and just talk to our students, please?" So I go in to talk about the cesareans, mention that I had Hirschsprungs and that my daughter would had Hirschsprungs. And that's it. The cesareans can do one. They want to know all about Hirschsprungs.
Hirschsprungs.
They don't want to know about anything else because we know, we got told at university we'd never ever meet anyone with Hirschsprung's disease. This is what one of them told me once. I was like, well, now you've met someone who's got 3 people in the family. So, and they want to know all, they're not interested in the cesareans. They just want to know about that. And then I end up having to sit there for an extra hour, talk to them about that. So
Yeah,
people, students and that really find it. So I do that once a year. And they're fascinated and they're all writing notes and getting all excited because they've met someone with it.
brilliant.
But yeah,
That's fantastic. But again, we are so rare, aren't we? In the fact that I mean,
Yeah.
that's part of the reason why I started this because I didn't know anyone with it. So I
yeah,
thought, well, I wonder if I can find people. I wonder, and I've managed to find about 70 odd. But
yeah,
imagine if I can find, you know, people. But it is a little bit needle in a haystack stuff, isn't it?
Yeah.
yeah,
Because
it is.
Well, we are unique.
Yeah.
I've got a favourite word
Yeah,
though.
we all go back. We were supposed to rest of fan. We're unique, so
yes, and on that unique point, I know there was something you wanted to talk about. I know obviously Hirschsprung's makes you unique in terms of the 1 in 5,000, but there's sort of correct me if I'm wrong, but there's another genetic reason as to why you're unique. Did you want to talk about that as well?
I can't explain that.
oh, complex, isn't it? But my story in a minute and my daughter's story. But what they asked if they could do the genetic testing on my daughter to find out why we haven't, because she's the third one in a line of us who's got it, obviously. And they wanted to find out what the reason was because we have no other medical conditions. And usually it's linked to boys and mainly boys and mainly children with Down syndrome is what we've always been told. And that Dad was told, or my grandparents were told that he would never move, he would never pass it on. That's what they that in the 60s and 70s. That's what they were told. They will never pass it on. So obviously, when I was born in '83, and then I had it, my nanny was
Oh,
furious,
shoot, terrible.
interested. I said, "Would you mind if we did the genetic testing on your daughter, Gemma?" I was like, "Yeah, I'll ask her." I mean, she was about, she's 13 now, so she must have been about 11 when they did it. And I said to her, "Do you mind?" She went, "No, I don't mind," because she's as interested in helping people as what we are. So so she did the blood test and everything. It took a while because they've been doing it at the University at Cambridge. So they came and did it, took all the tests and stuff like that. And then I got a call, I must have been about a year into it. It took a long time. And they said, "Could you come and see us?" Because we're from Norwich. So the Norwich Norfolk Hospital. So yeah, that's fine. So I took my daughter up there. They said, "Bring your daughter with you so we can talk to her as well." So I took her with me. And they said, "So we think we've found the gene that you have. We're not 100% sure if that is the one. We need to do more testing," and start talking to me about how it affects families. And he said, "But we're not 100% sure because we're always testing it all the time." And I can't remember a huge amount of that conversation, if I'm honest, because it went straight over my head. But it was very much, we're still looking, and do you mind if we keep looking? And I had to sign permission for them to keep testing stuff and looking at different things. So anyway, about month or so ago, I got a letter, didn't
Yeah.
I, to say we found it. Could you come in? So I was like, yeah, of course I will. Then I had the letter. They sent a letter within a week, and they wanted me in a week later. So I said, "Do you mind if my dad comes because he'll find it really interesting?" And obviously, he's affected by it. And my mum came, so because mum is a clever sausage, and she'll be able to understand it better than we could. so so she came along too, and also she's been a massive part of it too,
Oh
hasn't
God,
she?
yeah.
So being married to someone and
Yeah.
mother of someone, a grandmother. So mum came along too, and they said, "Bring your daughter." So we all went, and basically they found a gene called FOX2B, which they said ours is a lot shorter than a normal person. Oh, let's not say normal, but you know what I mean.
Yeah, yeah.
He said, however, yours is incredibly rare because there's only one other family with 3 generations in the world that has the same gene cut off at the same time who don't have any other conditions that come with that gene deformity, shall we say.
Yeah. Yeah.
So that gene is formed before your body is formed. It's literally in the embryo. And that is the gene that starts. He said it literally is when you look at an embryo, just as it's turning into a human, it'll have like a line, like almost like the spine, and it sits on that, and then it literally go. Say he said, say it's on top of your head. He said it will come down, and he said it forms your nervous system. It forms your eyes, nose, ears,
Everything.
your all those
Oh yeah.
sensors. He said, what else? I can't remember
A
everything.
lot.
It
Everything.
does a lot. He said, and as it moves down your body, at a certain point, yours has just stopped working, and that is where Hirschsprung's kicked in.
Because when you form a gene,
Sorry.
you have multiple letters and numbers. Hello?
Yeah.
So you have multiple letters
Yeah.
and numbers. So they got to Fox, which is PHOX
Yeah.
2B,
Yeah.
but then you can have FGH397,
Yeah.
and your genes can keep going. But that is a very short
Yeah. Very.
Fox 2B, which
Yeah.
is very short.
Yeah.
And then that's why it didn't
Which is rare.
Yeah.
That's the rare part.
Yeah.
and that's why the gene that's why the nerves are not in the valve.
Yeah. And that's what
Does
just
that make
stopped.
sense?
Yeah.
I
Yeah.
think.
Yeah.
Yeah, that makes sense to me. That's fascinating. I love all this genetic stuff. I really
Yes, doing it as clever. But he said that that gene also, there's 2 other conditions that come with that gene if it's deformed. I don't like using that word, but that's
No.
the only word I can think of at the moment. And that is neuroblastoma and no, I can't remember what the other one is, but it's a breathing problem basically, and it's to do with the lungs.
From it.
And people have died, children have died from it. It's from birth. These 2 conditions are from birth. So I freaked out. I was like,
Yeah, we don't.
I just had neuroblastoma and thought, well, that's a brain tumor. But it doesn't mean I'm going to get one later on in life. But he said, no, it's from birth. So he said, and what it is, people with that deformity with that gene with that deformity would have one of those 2, either both or one of them, and then get Hirschsprungs as well on top of that. But we haven't got those other 2. We've just got the Hirschsprungs.
So
So there's only two families in the
so
world.
our Hirschsprung's linked to this gene only, rather than other things branching off.
Yeah.
But the other thing he did say, you definitely got to get this breathing deformity.
No.
You definitely got to get this brain thing.
No.
Well,
But that's there.
Say that if you were going to get the brain thing, that develops by the time you're 7.
But yeah.
And
That's
quite
right. Yeah.
children have that.
Yeah.
Yes.
Quite a lot of children have brain
Yeah.
tumours around that age.
People are funny people. do.
No.
But if you get to 7 and you haven't got a brain
You're
tumour,
fine.
you're not going to get
You're not going to get it. Yeah. It's in
Okay.
infant. It's in childhood.
right.
So, but we're the only there's only one other family, like I said, who have got the same. So that's why we keep saying we're
So
unique.
unique. We have a bit of a laugh at that.
Yeah, absolutely. And I
Yeah.
guess with the other family as well, I know there's HIPAA laws and all of that stuff, but they didn't tell you roughly what country this family is in or whatever where they are.
Oh, yeah.
They did.
Asia was an Asian
It's
country.
an Asian
country
we think.
in Asia, somewhere in Asia.
No, that was
Oh,
something
that-
different. Yeah, that family he tried to link to see if that, but they had other issues.
Oh, right.
They had like eye problems with their eyes. So that was something different. He thought it was them, but it wasn't. Then when he said actually they might be in America, but he's not 100%
We're not
sure.
going for that. We can't.
Yeah.
We
No.
can't be precise for that because
No.
obviously he was very very
Yeah.
he would give no information away.
Yeah, because
No,
obviously it's
Rightly so.
confidentiality. Yeah.
Rightly
Yeah.
so. We totally agree with that as well.
Yeah.
So, but yeah, that's
But yeah, that was really
that was,
interesting.
a little bit. But I got a bit of a headache when I related to genetics. I had a little bit of a headache. I thought, oh, what on earth did he say? But we all went home and had to talk about it and we sort of like understand a bit more now, don't we?
Yeah.
But they had sent us letters now to
Yeah.
fill forms in to have all the genetics done and all this extra tests done.
We also found out because obviously I'm the eldest of six, and I'm the only one who's got it. My siblings never got it. And we also found out that there is they would like to
Oh, yeah.
eventually test my siblings as well because they've three of my three. I can never remember. There's so many of us. Three of my siblings have had children, and none of them have got it either. So they said the chances of them my siblings having it is slim, but there's still a chance. So they'd like to know if they've got that gene. Because if they've got, say, for example, my brother who has two children, they're all okay and haven't got Hirschsprungs. However, they still could carry the gene, which means they still could carry it on later on. So he said what he'd like to know is, say, for example, my brother, he'd like to know if he's got it. Because if he hasn't got it, then he knows the kids definitely haven't got it, which means that it's not going to pass on. So
Okay.
they want to test. They're testing me. They're testing you.
Yeah.
Then they're gonna when they find out what they can find out from us. Then they would like to then test my siblings. So then eventually whoever out of my siblings has got the gene, they'd like to then test their children, but we don't know if it'll go that far.
Because, like, if one of the granddaughters, say, has got the gene, they find that one of the granddaughters has got the gene,
Yeah.
then they can offer them IVF
Yeah.
later on down the line, and so they can eradicate it.
Yeah. At embryo stage, they can
yeah.
get rid of they can like almost like clean the embryo. But
Yeah.
I've heard like they've offered that to Jessica, my daughter, as well, and they've said to her that if you want to have IVF, she doesn't want to. She said, "No, I'm not doing that because that could take chance away from me having children at all. If they do that every time I have a baby, I may never have one because IVF don't always work." You know, she's only 13, but even she could think of that one. But I said, "But we live with it, and that is as awful as it is. It does. I had two children before I had Jessica, and they ain't got it. So who's to say that she's going to pass it on?
Yeah.
You know?
You won first.
Yeah.
And we didn't stop. We had five more.
Yeah.
We had three boys and three girls.
Yeah.
I think it's a personal choice.
It is a personal choice. Yeah.
You know, I had 6 children. My first child had it.
Yeah.
And then every time I then went on to have another child, I was petrified. I mean, I was absolutely petrified that I'd then have another child with it. Because at this stage, I didn't know how Gemma would. I always thought Gemma wouldn't be able to have children, and I was worried about so much about her. And then I kept having children, and I kept thinking, oh, if I have another one, I don't think I could cope. So I would have personally have liked to have had the chance of having the embryos cleaned. You know, for me, that would have been a yes for me. But I think that's a personal choice.
Yeah.
Yeah, you're absolutely right. I think personal
It's very
choice
interesting. It is very interesting.
it's really, really interesting, especially as you say that you're the eldest of six and your other five siblings don't have Hirschsprungs, and then you have
No signs at all.
Yeah.
and then you have three daughters and one has Hirschsprungs and the other two don't have Hirschsprungs,
Well,
which
the youngest has got her from.
Yeah, I got with it. So I kept having them, and then she was born, and I was like, oh, there we go.
yeah, there we go.
Didn't get away with that one that easily, did I?
And she's long,
well, she's
long segment again.
all of us. We've all had about 2/3 removed of our life intestines removed.
Yeah.
So yeah. So then obviously I was born in '83.
Yeah.
You can tell because I wasn't really.
I remember what in '83. Because of the history of Hirschsprungs, Gemma didn't pass the meconium straight away. So my wife then ran to the hospital and said, look, you know, this Hirschsprung's in our family. Couldn't be that. I think they ignored that for a little while, didn't they? They dismissed it. for a while.
In '83, they don't like.
They don't like to be told what to do.
They like to be told that that you self-diagnose. I mean, you can today, but back then,
they didn't. They dismissed it in not. How do I say? They just completely dismissed it. They said, "No, well, we get lucky enough. My wife was quite persistent and kept saying, look, well, there's something wrong here. We've got Hirschsprung disease. Can you please look at it?" 5 days later, we went into the hospital, and all of a sudden, that was all hell that broke loose. They had an ambulance at the door. 2 ambulance drivers came in. We're taking it to Great Ormond Street. And that was like, I didn't have a chance to pack, do anything. So my wife went down in the ambulance. I followed in the car, absolutely terrified.
He said, didn't he? The ambulance driver said, if my blue lights go on, do not follow me.
I said, you got no chance, mate. You won't lose me. Can you imagine saying to her father? That ain't happening. Anyway, we got to Great Ormond Street, and tiny little bundle she was, and put her on this massive thing. Next thing, surgery. Didn't have a clue what was going on. Didn't have a clue, but they were absolutely amazing. A great old thing explained all to us, and we went through all that. And she went through hell. She 2 weeks in the hospital. We brought her home. Then she went 6 months later in January.
First, didn't they?
Yeah.
Because one was the first one to have it in 2 operations.
Yeah. Well, what they'd done the first one. They'd done the pull through in the following January, and then Mr. Brereton, her surgeon, called my wife and I and said, we've got to try to do it in 2 operations, a pull through. So we've got to do. They've never done it before. We've got to try it. We said, right, okay, do you give permission? We said, well, yeah, obviously. So anyway, that was successful. They done it. And he called us in the office, Mr. Brereton, and he said, it's actually gone into the medical journal. The first one we've ever done in 2. That's what he told us.
Again, well, I'm unique twice, so.
But we didn't understand a word what he was saying, to be honest. We didn't have a clue what was going on.
You had a colostomy, didn't you? I had a colostomy for how many months must I have had one then?
8 months, 6 months, Carol?
Yeah, 6 months.
Yeah.
Because then she had to do the washouts. But she was amazing as a little baby. Oh, she's so good, wasn't she? She was amazing. But we went through, had all that done, and that was brilliant. The problem, Gemma, I'll just tell her this bit, because then she can carry on after this. The biggest problem she used to get is prolapse.
Yeah.
She used to get a lot of prolapse, a hell of a lot.
Still do.
But she dealt with it herself as a child. She's, what the... Because my wife done it at first, didn't you? And eventually she wanted to do it herself, and she was amazed. She done it. She
I used to miss myself a lot.
A lot.
A hell of a lot. But that's just something that comes with her, unfortunately.
But the rest of the story, I think she tell herself.
Yeah.
You remember that, don't you?
Yeah, pretty much. So I can remember like things like I'd sleep around my grandparents' house, and I would get up in the night, and my mum and dad would always send me like those knickers just in case. And I know that I would get up and I'd mess myself again. So I'd even at the age of like 6, I'd wash it under the sink and hang it over the edge of the bath and all that type of thing. And that's just, again, didn't know any different. So you just get on with it, don't you? School was difficult. I had a really good group of friends around me. One in particular, I'm still friends with to this day. Would if I'd go, I really need to go, she'd grab me by the hand and run me. And I mean, like pull me through crowds, tell people to get out of the way. She would get me to a toilet. The schools were always fantastic though, and would give me toilet passes and let me go when I needed to go. They were always. I don't know what your schools were like, but
mine were nightmare.
Actually, we went to the same school, didn't we, Dad? But by the time I went there, it was completely different, and you could go. And I think I was left to mess myself once at infant school, and Mum absolutely kicked off big time, as you can imagine. But yeah, that it was just I things that, like we said a minute ago, I don't know any different, so I don't know.
It was normal or not.
What was normal for me? That was so. I just dealt with it. I never really whinged.
No.
I never have done really. I mean, I now have a stomach pain 24/7. It never goes. I've got one right now. It never goes away. It's like a dull ache all the time. But I don't whinge about it. I don't go on about it. I get on with my day. I still have had children and lived as normal life as I can. Like my husband's a bit of a whinge bag when it comes to being poorly, but when I go, what? shut up, that sort of thing. But I just don't, because I've always lived with it. I don't know any different. So you just get on with it, don't you? You know. I mean, I feel like I need the toilet 24/7 as well. That's something that's happened over the last 3 or 4 years, which is why I had to have a colonoscopy last week, and they've now found I've got diverticulitis as well.
Nice.
So,
Good to have something else.
Why not?
to your bowels. So I've got to do all that as well now. But and they weren't helpful either because they went, well, you're just gonna have to live with it, is what the man said to me. I was like, what? What? So I wasn't like I just completely been left in the dark. But yeah, but school, like I said, school was great. Had few accidents at school, would get a lot of tummy pains, blah blah blah. As I got older, again, just lived with it. Had managed to have three healthy daughters. Um, First one, she's actually sitting right there. She's nearly 20 now, but she had her nearly couldn't have any more children because I had to have. She was 7 weeks early because I got preeclampsia. So I had to have 7 weeks early. So I had to have an emergency cesarean, and they almost cut through my fallopian tubes because you know how it should go like this. Mine was like that, and they nearly cut right through them because they didn't know that they were like that. Because, and I said, why is it that happened? They said because of your last surgeries for Hirschsprungs, everything, and you got so much scar tissue, everything has like grown back, and everything's like moved around, and yours has just done this rather than stay like that. I was like, and they said, and we were millimeters from cutting both through both because we didn't know it was like it. So, but they went, can where they should be. I was like, right. They went, you were really lucky to get pregnant. I was like, really? They went, yeah, because they were almost twisted as well because of the Hirschsprungs. I was like, wow, okay then. Then had my second daughter 3 years later. That went, pregnancy was fine. Hirschsprungs, would just get in the way, but just live with it again. Had another C-section with her. That all went fine. And then we had Jessica.
Yeah, it went,
And it all hit.
went belly up there,
It all hit the fan. I won't say the word I want to say, but it all hit the fan.
literally.
You can say the word, it's absolutely fine.
Fun. It's fun. I mean, that's what we get raised and talking about. She was born in 2012. And I had a C-section again because of my last surgeries. They said it was too dangerous to push her out, so I had a cesarean. And the cesarean itself was awful because of the 4 surgeries I'd had before in that area. I had so much scar tissue. They got her out fine, but I had so much scar tissue that all of my organs had fused together. So my bowel was attached to my bladder and blah, 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 blah. And they said, it's too dangerous to close you back up like this. We need to separate it all. So I laid on the table, on the slab, as it were, wide awake. And they stopped working. And my mum was with me. I said, what on earth's going on? And the surgeons obviously heard me, put her head over the curtain. She went, I'm really sorry, but blah, 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 blah. All the stuff is together, waiting for a general surgeon, but he's in another surgery. So they came back about an hour and a half later. I laid there with all my stomach open and everything. He came in and he went, oh, yeah, this is bad. Great. Thanks, buddy. So my dad and my husband were outside. Didn't have a clue what was going on, did you? They were trying to find them because they went for a coffee or whatever, and said to my husband, "No more children. If she has another child, that's going to kill her." So I was not. So he had
I was there as well.
He was there as well. So I think the collapse if he was on his own, but luckily Dad was there. But got her out fine. Perfect little baby, 6 pound 3, tiny, all this dark hair, absolutely stunning. And then literally that evening, I had her in the morning. That evening, I thought something isn't right. She had her tummy was swollen. She looked very pale, a bit sweaty. She just didn't look right. And I just said to the surgeon come around to see me after my C-section to make sure. I said, let's come and look at my daughter, please. Something isn't right. She hasn't pooed yet. We've got Hirschsprungs in the family. I had it, my dad had it. Please, can someone come and see her? It took them about a day and a half to come and see her. She wasn't feeding. I was breastfeeding her. Everything that she ate just came straight back up again. And they were like, oh, and all the midwives were like, oh, she's fine. She'll pay eventually. I was like, but that's I mean, why are you not listening? After a day, the surgeon then came to see her. The actual surgeon who actually and is still our surgeon to this day. I mean, she's 13 now, so that's how long he's been in our lives. Actually came to see her with all his students. Looked out. I mean, her tummy looked like a big blister. She pooed it. She's sick. Yeah, there. That came later on. Her tummy was just so swollen. I mean, it was veiny. It looked like it was going to pop any minute. It was like stretched. It was like shiny. And I was like, but look at her stomach. There's something wrong. I think she passed like a quarter of a pea size of meconium. So that's why they thought, oh, she hasn't got Hirschsprungs then. But I swear it was like a tiny little nugget. So I was like, no, there's something. This isn't right. She's not eating. Everything that is going in is coming out again. I said, please just check. No, no, she's fine. Moved her legs about, all that. And I was, right. So 3 days I was in. Then they sent me home. By day 5, she was being sick. And I mean, it wasn't even milk. It was brown. It stunk. Still hadn't pooed. It was awful. And I rang them. They gave me their number, the ward that I was on. And they said, ring us if you need any help. So I couldn't this is in the middle of the night. I couldn't ring my midwife. So I rang them and they laughed at me and said, oh, it looks like you're in for a tough night, dear, she said to me. I was like, well, hang on, my daughter is sitting up, but it's no. So I need someone. So in the end, I had to ring my midwife, and my midwife actually was fantastic. Absolutely, she was with me for all my pregnancies. She's phenomenal. Sorry. She came out the next day. The next day, she went, I can't get there till about 1. Is that okay? So I said, yes, fine. So she came, she went like, can I see you feed her, please? So I fed her. Within seconds, all came up. And it was just brown, slodgy, it was just disgusting. And I said, she's got Hirschsprung, didn't she? She went, I'm not ruling it out, but don't panic. It may not be. So she weighed her and she'd lost over 12% of her birth weight. She's gone down to £5.8. So I was like, see, I knew it. And anyway, she went off, made a phone call. She went, oh, you need to go to the hospital now. So I thought I knew it. I just knew it. So I went up there and the surgeon again, same surgeon, put his finger up her bum, all of it. Whatever was in her bowel just came flooding out, and he kept putting his finger up there, and more came out. She was screaming bloody murder. I mean, you can imagine how tiny she was. She was 5'8", just minute. And he actually sent me out the room because I was so distressed by watching this, and I just had this awful C-section as well. So I went out the room. My husband took me out, and they went, we need to keep her in overnight, and we're going to have to test her for Hirschsprung's disease. So this was day 5. Day 6, she's put into a separate room in NICU. They did the test, but I wasn't allowed to be in the room, he said, because it's not very nice. And they took 5 biopsies, every centimetre from her rectum, every centimetre up of her large intestine. And he said it won't take long, but it might take a couple of days. Within, I think it was about 12 hours, he came to find me. He said, look, I wouldn't normally say this to parents of children I think may have Hirschsprungs, but because you've got the family history and you know so much about it, I'm 70% sure she has it, because in the biopsies we've done so far, we can't find any ganglion cells. It's like, right, okay. So I was like, I knew it. And then within, I should think that was another 6 to 12 hours, he confirmed that she had it, but they think that but he said, but in the last biopsy, we can find 1 cell. There's 1 there, which means she's not gonna be long segment like you and your dad. She's gonna be short segment. I was like, right, okay. He said, so what we'll do is we're gonna train you to do washouts. We'll get her in for the first surgery as soon as we can. We might be able to get it done in 1 surgery. I was like, oh, right, okay. He said, because it's short segment, we might be able to do it in 1. We have done others in 1 before. She's not going to have to have a bag, nothing like that. So great. Oh, well, brilliant. If that's the case, absolutely fantastic. She ain't going to suffer like me and my dad have. So then we were sent home to do washouts for 7 weeks, I think it was. Then she went into hospital. She was in hospital. I would say she was in there. I would say for an hour, and we got the buzzer go off, come back. He said no. He said there's much more affected than what we originally thought. We've had to give her an ileostomy bag. because which I don't. You obviously know what an ileostomy bag, I assume.
Yes.
So I was like, so I didn't. I'd only ever heard of colostomy. So I was like, what the hell's that? So he said, so basically, where you have a colostomy on one side, you have the ileostomy. He said, we've had to put it in the bottom half of her small intestine, the bottom, right at the bottom of her small intestine, right where her appendix is. I said, right. He said, because we don't actually know how much of the bowel is affected. I was like, right, well, how long is it going to take to get the next surgery? He said, we're going to have to we took biopsies all the way along it, and we'll see how much is affected. I was like, right, okay. So, so, I was like, right, okay. So I think she was born in March. She had a first surgery April, May. I think it was like the end of May. Yeah, it was the end of May. 'Cause it was just for your birthday. So it was right at the end of May. And then she had her last surgery in October. So we had to sort out the ileostomy. Oh, they're a nightmare, aren't they? Blooming colostomy bags and ileostomy bags. Oh, goodness me. Because obviously I had two daughters who were older, so I was doing school runs, and every time I went to go and leave a bag, take the school at burst, and I had to get my neighbour to take the. Oh, so anyway, she had her second surgery, and he said 2/3 the same as you and your dad is affected, so we're going to have to remove it and then do the pull through. So that's what they did. She's really suffered, hasn't she? She's like I said, 13 now, but she was in naps until she was about 6 because she was just so incontinent, she just couldn't hold it in. She's obviously goes to school, but she has a lot of time off school. Because she gets lots of pains and stuff like that. She's still wearing pads to this day because she's still incontinent. She has to have lots of loperamide every day to because her poo is so soft. So it kind of thickens it up a bit. Although I don't really notice, not that I look in her knickers anymore. She's 13, but she says that they ain't any different. And she also has to have a washout every day in the mornings. We've only been doing that now for about 3 years, I think. But then they wanted to do an ACE procedure on her because they said we think that's going to keep her cleaner. Because obviously the peristing's okay, but it goes up the bum. Washing, it's not going to get all of it. If her bowel's full, it's not going to wash the whole lot out, and it isn't. It's not keeping her clean. So we just said surely an ACE at the right at the end of the large intestine to wash it out from the top is going to be more effective.
Yeah.
So we're waiting for that surgery at the moment. We were told she could have it, and with a year's wait in September, so hopefully it's from this September she can have it. But she really still really does suffer, poor little bugger, didn't she? It really does. Like some days she can be a normal 13-year-old, typical moods, the whole shebang. And like you wouldn't even but look at that, you wouldn't think. I mean, she's a normal height, she's a normal weight, everything. But she just, I mean, every day she's, my stomach's really sore today, Mum. It's really sore today. And then I'll constant text messages at school while she's at school because the school have been phenomenal. They are absolutely brilliant. I cannot fault them. They have given her own toilet. She has got, she has a bag in student support that's full of clean clothes and extra pads and wipes and creams because her bum can get really sore because obviously the acid in the poo isn't being filtered out, so then that gets really sore. And because she's incontinent still, that it burns if she doesn't get to the toilet in time. So then leaves her really with nappy rash. Basically, I mean she's 13 with nappy rash. I mean that's ridiculous. But so then she has to put cream on that, and then she has to come home because the amount of times I get a phone call saying, "Can you come and get her?" She's messed herself and she can't. It's too much to clean. So they give her the bag. She goes and sorts herself out. They've even said she can use the the staff shower if she really needs to. So they've been amazing. I can't fault the school at all. She just misses a lot of school, which worries me. And she's now at her school. They do GCSEs for 3 years, not 2, and she's now about to start them in September. And I'm a little bit worried she's going to suffer from it. She shouldn't do, but I am worried because the school are good and they'll send work home, and I'm an ex-teaching assistant, so they know that I can help her and set her up and everything like that. But she really just does suffer, and I just really hope the ACE procedure makes a difference because it's just so she's clean at school. I think that's the biggest issue. It's just I just want her to be clean at school because she's had to deal with bullies, hasn't she? Um, um, yeah, just I mean, that wasn't actually when she started junior school. She's now at high school, but when she was 7 or 8, she was in I don't know how old they are when they start junior school, but you know what I mean, that age. And she went to the toilet with her bag, like she always would, went into a certain toilet. When she could hear loads of girls in the toilets, and when she came out, they were all crowded around the toilet door and going, "Oh, nappy girl, you have to carry a bag, you have to poo yourself." And they were all a year above her. Well, I worked with that year group, and they all knew me, and they knew about her because she was at the school when I worked there. And luckily, one of their fellow students in the same year came in, caught them, and went, "Home," and they all went running off. And she told all the teachers. Well, the teachers went mental, as you can imagine. Things with Jessica really affect her that much. She's just she's like my dad said that how great I've been. She's been fantastic too. She just goes, "It's who I am. I can't help it." And in the end, it got so bad that my husband, who works at that school, I worked at the infant school, he worked at the junior school, ended up having to do a talk to the children with diagrams and pictures of large intestine and telling them how much she's had removed and this is what it is and this is why she has pains and blah blah blah. Because she gets a lot of pain as well. Like we call them her moments. And she can't move. She literally is in so much pain. She cannot move. If she goes up to any sort of exercising, even if it's going for a family walk, she has to stop, cross her legs, and she has to squeeze someone's hand, and she goes bright red and sweaty. Um, and so we had tests done at the Royal London Hospital because her bowel specialist said I'd like her to get it done and have these tests to test her bowel, see what it is capable of. So it came back that she definitely will need an ACE eventually, which we've obviously, this was about 3 years ago we did this. And he said, the doctor came back and said, she's got a little bit of control, but there's not enough. And she's getting the pains that she's getting because she has got a what is it, hypersensitive rectum. So she can literally have a 15 mil of poo in there and she gets the pains. She feels like she's got to go and she's got to go, but there's nothing there. There's not enough in there to get out. So then she's in pain. So that's why another reason why they want her to have the ACE procedure because they said that that would hopefully empty the bowel completely, stop those pains from happening. They don't know, they're not 100% sure it will work, but we've tried every single avenue. So that's like the last resort, really. Because what else can you do? Again, I said to her, might just have to live with it. Because I get pains like that, and I have to just live with it, you know. But and I do try and drum into her. You just have to get on with it, sweetheart. I'll do everything I can to help you. Obviously, if you have to have medication, have it. If you have to have an anesthesia, that's up to you. You're 13. That's your choice. If you want it, have it. However, something you're just gonna have to live with.
Yeah.
And you're going to have to just push through it. When it comes to be at work, when you go out to work one day, you are just going to, if you've got a tummy pain, you can't just have a day off for it. You've got to have to just live through it. Paracetamol does nothing. I don't know about you, but actually, I don't think paracetamol. Nothing.
No, no, absolutely not. But no, just as we've got sort of about a minute or so
Yeah.
to go, I'd just say thank you very much to both of you, well, all three of you, for
Yeah,
coming
no
on and sharing. And I guess sort of future wise, I know you've talked a lot about Jessica and about the ACE and about how that may go. And I guess it's for me to just say that I wish her all the best, very
Thank
much
you.
so, with that.
Yeah.
And again, all three of you, with all of your Hirschsprungs, because again, I I wish you all the very best with the genetic testing as well, and all of the tests and whatnot that's going on. But yes, thank you, all three of you, so
you're
much for
welcome.
coming on.
Yeah, been nice to have a talk about it. Thank you, Tom.